So I'm here with medical student Cole. We're going to be recording a part of our faculty development class. We're going to be just recording a quick 3 to 5 minute clinical teaching skills. Is it okay if that we record you, Cole?
Yes.
Okay, great. So Cole, tell me a little bit about your patient that you saw today.
Okay, so I just got done speaking with Mr. SC, who is a 50-year-old African-American male with a past medical history of hypertension that presents today for evaluation of his blood pressure. So he states that he was diagnosed first with hypertension 5 or 6 years ago and was on hydrochlorothiazide 25 milligrams by mouth every day until about a year ago when he was incarcerated for cannabis use or cannabis possession. So since about a year ago, he's been off all medications for high blood pressure. In addition to that, he reports not checking his blood pressures. He admits to a high salt diet, or exercises about once every 2 weeks, and other than that, like I said, he's not on his medications. He denies review of systems pertinent to hypertension, including headache, dizziness, lightheadedness, and he has no chest pains or anything like that, and blurry vision. Additionally, he has a 15-pack-year history of tobacco use and is not interested in quitting at this time. His last labs were drawn on September of 2011, but it did not include a lipid profile. Other review systems were negative, except for tooth pain that he is asking to be referred to a dentist for today. On physical exam, he has trace pretibial edema. He is not alert. He fell asleep 2 or 3 times during the physical examination and attributes that to not sleeping well because of his toothache. His conjunctiva are injected, and he does smell of cannabis today, but doesn't say. He says that he hasn't been using any cannabis at all, but he is around people that do. So, for my assessment plan, actually, before I do that, physical exam. The nurse read a blood pressure of 164 over 108. I rechecked it around 30 minutes later after he had had time to calm down, and it was 155 over 95.
Okay.
So my assessment plan is number 1, hypertension. According to JNC 8 criteria, he meets the criteria for treatment of hypertension. So I'd like to put him on the same dose of hydrochlorothiazide that he was on in the past, 25 milligrams every day, and then reevaluate in 2 months at the clinic for his blood pressure. I also educated him on the importance of regular exercise, salt restriction, as well as medication compliance. And then my number 2 on the assessment plan is tobacco use. I educated him at length about the effects of tobacco smoke on all the various body systems, including the effect on his blood pressure. At this time, he does not wish to quit, but I did give him resources and tell him that we have a counselor and things that we can give him to get off of it should he decide to do so. Number 3 would be a toothache. Exam showed no infection, but current infection, but he is asking to be referred to a dentist. And finally, number 4, healthcare maintenance. I'd like to get him a pneumococcal vaccine because of his smoking status. And I'd also like to refer him for colonoscopy because he is 50 years old. He has never had one. Has no family history of colon cancer. And then prior to next visit, which I would say in about 2 months, I'd like to do routine labs on him, including A1C, lipid profile, and CBC with differential, along with a BMP.
All right, great. Cole, you did an excellent presentation. You described Mr. SC very well for me, and I got a good summary of the patient, what our current problems are, and where we need to go with this patient. So your number 1, I guess, problem on your list was hypertension. Just to kind of reiterate, what are your, can you summarize why you think this guy is hypertensive?
Yes, so the nurse read a blood pressure of 164 over 108, so that was my first clue, but his past history of diagnosis of hypertension also helps. So that shows me, I can't remember which JNC it was, but he has had high blood pressure readings on more than 1 occasion. And yeah, so that's why I thought so.
All right, great. And I like that you summarized JNC 8 and incorporated this patient as well as his care into your assessment and plan. When patients have high blood pressure for several years, we do worry about several complications. And you did already discuss tobacco use. We talked about the counselor that we have available. You talked about his high sodium intake, and I think you have an excellent plan in terms of starting him again on hydrochlorothiazide. Do we know if he was well controlled previously on that medication?
I did not assess that.
Okay, okay. And so based on JNC 8, the one that we were talking about, for this patient being his age, as well as his smoking history and other things, they've actually found very good benefit of calcium channel blockers, in addition to the thiazide diuretics. And so I agree, let's start him again on the hydrochlorothiazide. Maybe we can bring him back in 2 or 3 weeks. If he's not controlled at that point, that would be an excellent medication to start with this gentleman.
Okay.
He really hasn't been in the clinic for quite a while, so no labs since 2011. I agree, let's kind of screen everything from top to bottom. And I just want to add one thing for the PSA. And from your understanding, when do we check for a PSA on a gentleman?
I know the guidelines differ from organization to organization, and they're pretty loose guidelines as well, and there may not be any benefit for or against it. But as what I understand is that you screen for PSA if there are urinary symptoms or complaints, but I'd definitely love to look that up and get back to you on it.
Okay, okay. So I agree, USPSTF really hasn't made clear recommendations on when to screen and when not to screen. But what I like to do, especially in a high-risk population such as here in Inglewood, I do like to screen gentlemen over the age of 40 just because they have a higher or a more prevalent type of prostate cancer that we get concerned about.
Okay.
Okay. Very good. Any questions about anything that we've gone over so far?
Not at this time.